Hello everyone, and thank you for joining me in this video. My name is Dr. Oscar and today we're going to go through a really important topic, high blood pressure. So in really simple terms, we're going to understand what high blood pressure is, why it's important to have normal blood pressure, what causes high blood pressure, and how we go about treating it. So the main point that you will hear me reiterate throughout this video is that most of the time, high blood pressure has absolutely no symptoms. So unless you sit down and measure your blood pressure regularly, you will have no idea that your blood pressure is raised. So what do we mean by high blood pressure? So we are talking about the pressure within the blood vessels that carry the blood around our body. In simple terms, we can think of the heart as a pump and the blood vessels as the plumbing supply to the rest of our body. So what we're really concerned about is the pressure within that plumbing. So what should our blood pressure be? So when you're sitting down and measuring your blood pressure, which we have a video on, by the way, I'll link below, you need to use an arm cuff to measure your blood pressure. And ideally, we would like the systolic blood pressure to be less than 140 and the diastolic blood pressure to be less than 90. Now, these target ranges can vary depending on other medical conditions that you may have. So the best way to know about your particular target would be to contact your GP practice. Now, what are the causes of high blood pressure? We generally break this down into three categories. So the non-modifiable, meaning things we can't change, lifestyle factors, so things related to what we do in our day-to-day lives, and also some medical causes. So when we think about non-modifiable things, we think about age. As we get older, our blood vessels become stiffer, and so the pressure within those blood vessels can get higher because they lose the elasticity. Other things are family history and ethnicity. So if you have a strong family history of high blood pressure, then you have a likelihood of developing this later on in life. So it's even more important that you have it checked regularly, and if it is raised, that we treat it for you. So what are the lifestyle factors that can cause high blood pressure? What are the things that we do in our day-to-day that contributes to this? So number one would be excess weight and not enough exercise. Other things will be having a high salt intake in our diet, excessive alcohol, smoking, poor sleep, and stress. And less common, there are some medical causes that can cause high blood pressure as well. The most important one is sleep apnea, but there are lots of other medical issues that can contribute to you developing high blood pressure. So I'm going to circle back to our first point, which was that on most occasions, having high blood pressure gives you absolutely no symptoms. So if we do have symptoms, what will they be? So if our blood pressure is very high, so imagine our systolic blood pressure is over 180 and our diastolic blood pressure is over 110, we can start to develop some symptoms. So these may be chest pain, headaches, shortness of breath, feeling confused, vision changes. Those are really important symptoms and they should never be ignored. These symptoms with high blood pressure would warrant an A&E review. So why do we care so much about high blood pressure? What damage is it really causing to our body? And why is it important to normalize it as much as possible? Well, if you think about the high blood pressure within our blood vessels, it overstretches them and causes minor cracks and damage to those blood vessels. So those blood vessels can start to become stiff, they start to become inflamed, they start to build up plaques. And this is where we start running into trouble. So if this damage starts to occur in the blood vessels of our brain, we are more prone to having strokes, either from a bleed into the brain or a clot within the blood vessels in the brain. And it can also contribute to something that we call vascular dementia. If it starts to affect the blood vessels within our hearts, we are more prone to having heart attacks, where a part of the heart blood vessel gets blocked and a portion of the heart dies as a result. And this can contribute to heart failure as well, where the heart isn't pumping as efficiently as it would in a healthy person. Now, our kidneys are very sensitive to high blood pressure. It has lots of delicate little blood vessels that are involved in the intricate control of all the minerals and toxic waste that our body gets rid of in our urine. We are at risk of having kidney disease as a result of high blood pressure if it's not normalized. If the blood vessels within our eyes are affected, we start developing vision loss as a result of damage to the blood vessels in that area. And last but not least, when we think about our general circulation, if it's affecting the blood vessels that go into our legs in particular, then we're going to start having what we call peripheral arterial disease, which is essentially a way of saying that the blood supply to our legs has started to reduce, and we're starting to have effects of that. It can affect the blood supply to the erectile system and can contribute to erectile dysfunction. So now we know all about what high blood pressure is, what causes high blood pressure, why it's important to keep it as normal as possible. We now need to think about how we measure our blood pressure. So I've mentioned initially that if you have a blood pressure monitor at home, you can measure it at home using the video I'm going to link below. If you don't have a blood pressure monitor, then you can either visit a local pharmacy, and if they are part of the NHS screening scheme, they can offer blood pressure checks for patients over the age of 40. Alternatively, you can contact your GP practice and book an appointment with a nurse or healthcare assistant who can do your blood pressure for you. If we've identified that we are a person with high blood pressure, what do? We have two main ways of approaching this situation. We think about medications to help lower the blood pressure and reduce that damage that's happening in the background. And we have lifestyle changes that we can advise you to pair together to have the most optimum result. So depending on your age, your ethnic background, and other medical problems that you may have, the clinician that's looking after you may choose to give you medications that either relax the blood vessels to allow the pressure within them to drop, or those that affect the kidney to reduce the volume of blood that we have to reduce the pressure within them. Other alternatives will be the medications that slow down the heart a little bit to reduce the amount of pressure that it's producing. But aside from taking medications, these are the things that you can do to help improve your heart health. So if we have concerns that your weight is above ideal range, we may advise that some weight loss will be helpful. This not only reduces the strain on the heart, but it improves the heart's health because it's working against a much lesser load. The second most important thing, which goes hand in hand with weight loss, is exercise. Now, exercise not only strengthens our heart, but it also increases the elasticity of those blood vessels, making them able to not only withstand the blood pressure within them, but also to strengthen the heart and improve and lower the blood pressure that's circulating around our body. As we mentioned as well, reducing your salt intake is very important. When we have high salt intake, either the ones that are in our foods or the ones that we sprinkle extra on top of our food, we are drawing in excess fluid into our blood vessel, which can really increase the blood pressure within them. So we normally advise using less than 6 grams of salt per day. And this is even more important if you come from a Black Afro-Caribbean background or if you have kidney disease already. Other things that can be really helpful as well is reducing the amount of alcohol that we're consuming. So if you're consuming over the recommended amount, then reducing that right down to a healthy limit, or actually stopping altogether if you're able to, is fantastic. And last but not least, stress reduction. Now, when we are stressed, our stress hormones can make our blood pressure go up, and this can be contributed as well if we're having poor sleep. So practicing mindfulness and exercises to reduce our stress and anxiety has a really positive effect on the control of our blood pressure. So if you've had to start medication, but you do all of these lifestyle changes, there is a very good chance that you could be on the minimum amount of blood pressure tablets or even the smallest amount of dose to control your blood pressure. And in some cases, patients can come off blood pressure tablets completely, but you must always consult your doctor before stopping any medication, because we must ensure that your blood pressure is actually normal before we decide that you can stop and have a period of no blood pressure tablets, and we can monitor to make sure it's truly come down. So one piece of advice would be that if you're really motivated to do these lifestyle changes to reduce your blood pressure, start taking medications as well so we can reduce that damage that's happening in the background on a day-to-day basis. Lifestyle changes can take some time and they don't show its effects immediately. So it's really important to control the blood pressure during that time period. Once you feel like you've made enough lifestyle changes, we can reduce the dose or take you off the medication for a short period of time to monitor what your blood pressure is like. And remember, having to use medications for your blood pressure does not mean that you're a failure at all. There are lots of factors outside of what we do in our life in terms of age, ethnicity, and family history that play into our blood pressure. The main aim for us is to ensure that you have as normal blood pressure as possible to protect all of the organs that are affected by it. So the most important thing you can do is know your numbers, measure your blood pressure, and make sure it's well controlled if you do have high blood pressure. And if you ever want to revisit this video, make sure you save it and watch it at your convenience. Thank you for joining me today. Take care.